Welcome to Turnover Time, the AAST Associate Member Video Interview Series, where groundbreaking research meets committee expertise. I'm Joshua Dilday.
And I'm Erica Biscard. Each episode, we shine a spotlight on the innovative research and dedicated committees driving progress at the AAST.
Today, we're diving into the latest developments, sharing behind-the-scenes insights, and discussing the ideas that are shaping our future.
Get ready for an engaging conversation that connects research excellence with real-world impact. Let's begin. Hello, and welcome to this edition of Turnover Time. We're very excited to have another committee spotlight on the Economics Committee. Today, I'm joined with Economics Committee members, Dr. Philip Kim, who is an assistant professor of surgery at Hartford Hospital in Connecticut, Dr. Pat Murphy, who is an associate professor of surgery at the Medical College of Wisconsin, and associate member Dr. Faruqi, who is at Staten Island University Hospital in New York. And today we're going to talk about the recent publication from the Economics Committee entitled Making the Case for Value of Acute Care Surgery, American Association for the Surgery of Trauma Panel on Overcoming Local Challenges.
So the objective of the study was to help ACS leaders understand how to make the case for the value of acute care surgery locally and how to effectively communicate that value to hospital leadership. Our methodology included expert panel discussion at the 2024 AAST annual meeting with senior ACS leaders involving the review of literature, institutional experiences, and financial frameworks. The conclusion included the following. ACS demonstrably enhances quality and efficiency, underscoring the need for its value to be fully recognized within hospital financial frameworks. To effectively communicate with hospital leadership, acute care surgeons should understand the hospital's financial framework, tailor communication to the audience, that is, integrate clinical and financial data in reports and dashboards, collaborative cost saving leading to reinvestment in ACS staffing and education, and identifying and acting on future research priorities for optimal faculty and department development. We would now ask some questions for the authors. The first question is regarding what inspired this work?
Sure, I'll be happy to answer that one. So I think it really came from the most important question of how can ACS leaders effectively demonstrate their value to hospital leadership? Our committee in the past has done some work on the value of acute care surgery, looking at quantifying cost, defining and measuring quality outcomes, defining value in surgical care, and the economic value of an acute care surgery service. But all that work, we wanted to understand how we can have a practical aspect to that work to guide ACS leaders at every hospital to be able to demonstrate their value and communicate it effectively to their leadership.
Wonderful. What are the implications of your findings for practice?
I think the biggest implications first is that it requires us to understand the hospital's financial framework and their language. So first, most important thing is for ACS leaders to have an understanding and familiarity with the ACS financial metrics, understanding concepts like contribution margin, profit and loss statements, case mix index, payer mix index. These are all things that we argue that ACS leaders need to start to understand. And then another thing that I think is important is to think of everything in not only in terms of clinical excellence, but also financial value and financial sustainability, and really using and measuring that data to be able to drive partnership together, to work with hospital leadership, to start small, build partnership value-adding initiatives, to start small, build trust, show that you can bring value, not only great outcomes, but also improve contribution margins and decrease costs while providing the better care for our patients.
And to build upon what Dr. Kim answered, the big takeaway, I think, is kind of twofold. One is I think we all who work as acute care surgeons have an interest in this because it immensely impacts how and why we work the way we do. And so understanding that just from a perspective as someone who works in the system is incredibly important to understand the languages that impact your day to day. And then for those interested in becoming leaders or those who are already leaders in our field, in whatever role that is, hospital or practice side or both, this offers an opportunity to really understand from a nuanced perspective, where you might start if system changes are needed or wanted at your local level. And it provides you, I think, with some tangible frameworks to take away from people who have done this before. So you don't have to reinvent the wheel, and it doesn't have to be this monumental task. It really does frame it, for surgeons by surgeons.
What are the next steps for your committee?
One of the bigger next steps for this committee is a collaboration with AAST to really build upon this work and the work Dr. Kim had already mentioned, the four-part series that's published in Journal of Trauma, to provide not only leaders, but again, focusing on all of us who work in this field, to try to answer practically with real world examples of the business in acute care surgery, from both the funds flow, programmatic development, leadership development, and I think what I view as maybe straightforward things, but others may not. How do you make a schedule? And why is your schedule made the way it is? And, trying to start tackling questions of, well, if my ICU census is 30, should that be one team or two teams? And trying to take examples from centers who have thought about this at the ground level, and not only how they do it, but how they got from where they were to where they are now, to kind of give a roadmap for those who might be interested or those centers who might be interested.
Great. Well, thank you so much for your insight regarding the paper, and we are waiting to hear more from your committee and the remarkable work that you're doing.
That concludes another enlightening episode of Turnover Time.
We hope today's discussion provided valuable insights into the research innovations and committee initiatives that are at the heart of AAST.
Be sure to subscribe, share your thoughts, and connect with us on social media to continue the conversation.
Join us next time for more in-depth interviews and updates from AAST's dynamic community. Thank you for watching, and stay inspired.